Good afternoon, my name is Jason King, and today I would like to talk to you about an alternative method of recovery. But first, I would like to pose the question, how many of you watching this right now have either had an injury or know someone with an injury, maybe from a sporting event or a car accident or what have you, and that injury has caused surgeries, stints in rehab, or just a hindrance on your normal daily life activities? Well, the use of embryonic stem cells can cut your recovery time in half, if not greater than that. Now, a little background on myself and the reason why I am so passionate about this is because I spent 13 years of my life wrestling and competing. I've had and seen my fair share of very gruesome injuries, and I've seen friends of mine have to have surgeries and be in rehab for months, and a lot of times they don't come back the same. Now, currently, the use of embryonic stem cells is illegal in the United States, and that is almost due to a moral issue. So a lot of people don't like the idea of embryonic stem cells because it involves the destruction of a human embryo. However, a new method has been developed by scientists to where they can take a woman's unused egg, they can take it to a fertilization clinic, and let it grow for up to 5 days, strip it of all the stem cells from there in a process that they call in culture. Now, embryonic stem cells, even though there are other methods to deriving stem cells, are the most versatile and most effective. Now, you can get stem cells from bone marrow, you can get stem cells from blood, but like I stated before, the embryonic versions are the best ones to have. The main reason for that being is that early stem cells are blank slates, so to speak. Other stem cells, once they're older, have already decided where in the body they are, their function, and how they will interact with other cells. With a blank slate stem cell, you can put them anywhere in the body and they will become where you put them. If you have a back injury, if you have a knee issue, if you have an elbow surgery, the stem cells can get in there, become the other cells, and regrow naturally without the use of surgery, without the risks that comes with surgery, blood clots and infections and high anesthesia exposure, and to get you away from that long recovery period. Now, for a specific example on the effectiveness of embryonic stem cells, we would like to look at these two men here with the exact same knee injury. Now, in America, there are 600,000 knee replacements yearly, and a study done by the Mayo Clinic has shown that currently there are 4.7 million adults that are walking around with replaced knees right now. Now, this is John. John has decided that he would like to have the surgery. It's a very common surgery. He felt safe about it, decided that was the right route to go. Now, post-surgery, 3 to 4 weeks after, the initial swelling goes down, the incision will heal up, the stitches will come out, and you're on your way. 3 months post-surgery, you can return to normal activities, walking to your mailbox to get your mail, going to the park, maybe playing with your grandkids, anything. But it can take up to a full year for full function to return, for all the swelling to go away, and you might not be at 100%. Now, this is Steve. Steve has the exact same knee injury as John does, but he has decided he does not want to have surgery. He is going to opt for the embryonic stem cell treatment. Now, after the treatment, Steve is back to work in 2 days, and within 4 to 6 weeks, he can be back to high-intensity sports and basically be 100% again. So you're looking at a very large gap between a 6-week recovery and a year-long recovery. Now, currently in the world, there are 2 very good programs for stem cell research. There's Mexico and then there's the UK. And tons of athletes from America will get on a plane, decide they don't want to do the American way of recovery. They want to get on a plane and go to Mexico or the UK and get this done. Some of these athletes include Peyton Manning, who had it done on his neck, soccer player Cristiano Ronaldo, who had completely destroyed his knee and rebuilt it with stem cells, Rafael Nadal, and a few other people that have really loved the effectiveness that comes with embryonic stem cells. Now, even though the main topic of this talk is physical injuries, embryonic stem cells can be used to treat and cure other things as well, as certain types of cancers, diabetes, neurological disorders, even heart disease can be cured or at least greatly lessened with the use of embryonic stem cells. And as a government, I feel that they should allow for the recreational use of embryonic stem cells, mostly because if you see a viable option to help treat your people and you deny them of that viable option, I think it's just a very neglectful way to run a country. So that is my stance, and I hope I have helped shed some light on this issue for all of you.